I'm Dr. Melanie Pagette. Today I'm here to introduce my Smart Lipo triplex machine. This is an aesthetic machine which is for smart liposuction. Smart liposuction is not for everyone. It's for women and men who have a body mass index of 27 or less. That is also called a BMI of 27 or less. So people who are a little bit overweight and who have some areas of adipose tissue that they just can't get rid of. In fact, some people would not even be considered overweight, but they have areas such as in their arms or their neck or their abdomen or even their inner or outer thighs which bother them. We also do flanks. So we do several areas of the body with this machine. This is a fantastic machine because it's very safe, and it has 3 types of lasers within it that we use at various levels in order to melt the fat and then remove it. And what is so great about this machine is that you can have this procedure performed in the office under local anesthesia. So it's quite different from traditional liposuction. So traditional liposuction is performed typically in a hospital or a surgical center where you have to, first of all, pay a lot more money and you have to be put under general anesthesia. For those types of procedures, you typically have a lot more bruising and a lot more bleeding, and the incisions that have to be made for that type of liposuction typically are larger. So this is just a great way to go for people who want to have a procedure performed for less money and they want to recuperate more quickly. Some people have even returned to work in the same day, but most of my patients will return to work in 1 or 2 days after the procedure because they'll feel a little bit sore. So basically, those are the people that are the best people for Smart Lipo. How is it performed? Well, we do it right here in the office in this room. People will receive a medication to make them a little bit drowsy in another room, and then we escort them to this room, which is our in-office operative suite. I make some small nicks in the skin, and then I put in a tumescent fluid. And the tumescent fluid has a local anesthesia which the person needs in order to not feel the procedure. Once I insert all the tumescent fluid in the area which needs the surgery, then I use the laser, and I use the laser at 2 different levels. I use the laser at one level in order to melt the adipose tissue, and then I use it at another level in order to tighten the skin. So we heated the skin in order to stimulate the collagen, and then over the next several months the skin will tighten. And then I use some very small cannulas in order to remove the unwanted fat. So the unwanted melted fat gets suctioned into our cannula there, and then I'm able to place some small sutures in the areas of the skin which I had to nick, and then you're good to go. Now you will have to be escorted home by another person because you will feel drowsy after the procedure because of the medication that you use to make you feel quite sleepy. This is a very safe machine. In fact, it has 2 things in it, a thermoguide and also a thermochoice. And those 2 things help us so that we will not go above a certain temperature that I set it at, and that makes it a very safe machine. And it also stops the laser beam from even firing if the skin heats up too much. So it's just a great machine. It's very safe. People have gotten great results. One can even look on the internet and see people's before and after pictures, but it's just a great way to go for people that want to have a procedure done for less money and a quicker recuperation. So we look forward to seeing you if you need this type of procedure. Just call us for a free consultation anytime. This is Dr. Pagette. Thank you very much for your time.